Hello, this is the seminar on traumatic brain injury for ED 543. I'd like you to first think about what we know about traumatic brain injury before we look at this case study. We know that traumatic brain injury is a form of an acquired brain injury that occurs when sudden trauma causes damage to the brain. So the symptoms can be mild, moderate, or severe. And many times, even with the mild traumatic brain injury, the person can remain conscious or lose consciousness for a few seconds. Other symptoms are headache, confusion, lightheadedness, dizziness, blurred vision, fatigue, lethargy. And what happens with a person with this injury is that there will be some changes in sleep patterns, there'll be mood changes, memory problems, concentration problems, attention, and thinking problems. So it's a very serious injury, and I wanted you to look at this case study. Had we had the seminar, I was going to ask you if you knew anyone who had traumatic brain injury. And so we'll look at this athlete that is now trying to transition back to school. He had an accident. And so I'll let you read this. I won't read it to you. But Jesse Garcia was a model athlete, an excellent student. He was a role model. He had lots of friends, but he was in an automobile accident. And of course, that's one of the causes of traumatic brain injury are accidents, automobile accidents. And so he sustained head trauma. And he was unconscious several days, which tells us that it was very severe. And he was hospitalized for several weeks. So he has experienced difficulty with his attention, memory, and speech. Now, after his discharge, he spent time with speech therapy, physical therapy as an outpatient at the hospital. And however, his physical injuries are healing, but he's still having problems with attention, memory, and speech, and they think this will continue. And he's unable to focus, and we already said that concentration was a problem, memory is a problem. And so this causes him to get frustrated. He has difficulty remembering details about familiar events and facts, and he has slurred speech. So in order to allow Jesse time to recover, his parents took him out of school for the remainder of the semester. However, since he's been out of school, he's refused to see his friends. He spends a lot of time alone, and his parents are very worried. So a new semester is beginning, and they feel it's time for Jesse to return to school. However, he does not want to return. He doesn't want to go to school. He's concerned about how others will see him. He's worried about how he'll be able to handle the coursework. And his parents decided to push the issue, and so they set up a meeting with Jesse, his parents, the school counselor, and the therapist. So at this meeting, they shared the medical information, and the therapist also reported about his progress and his continued need for therapy. So given the information provided, the school counselor decided to set up what they call an MDT, multidisciplinary evaluation. The multidisciplinary team would do that. That's the MDT. And because they feel that Jesse might need special education services. So his parents are hopeful. They're hopeful that he may need this support and he can get this support. And yet Jesse says, why can't I just stay at home? He doesn't want to go back. So we were supposed to discuss the characteristics of an individual with traumatic brain injury. What characteristics does he exhibit? What types of information should be gathered during the multidisciplinary evaluation? Who should be present? Why? And if the multidisciplinary team decides that he needs special education services, what type of places and services would you recommend and why? Unfortunately, we're not able to have this discussion, but I will tell you that one thing I see quite clearly is that Jesse is depressed, and he's having a difficult time coping with the changes. If you can imagine that at one time he was this very capable, athletic person and a good student, and now he feels he has lost that part of himself. And so he's depressed and he's grieving. I would say he's also grieving because when we lose something, our abilities, we grieve that loss. So the real challenge now is how do we transition him back into the school? I will tell you that I was a school counselor in my other life, and I did have students that needed this type of help. One thing I would suggest is that we don't go for a full day at school, but we start with maybe 1 or 2 periods in the morning. I would also assign a friend to Jesse to be with him. I would have a group of friends that would be there to help him get from one class to the other because he may forget, get confused, or overwhelmed, and to be with him as he goes from one class to the other. So I'd pick someone that has a similar schedule as Jesse. However, I would transition him in with perhaps maybe 2 periods and then maybe move it up to 3 periods and maybe to a half a day. The other option would be to also have him complete some of his work online. At a school that I worked at in Wisconsin, we were able to send students to what we call the Academic Support Center. And there were 3 adults working there all day long, and they would work with students one-on-one on the computer. We had a computer program called Novanet. I don't know if it exists anymore, but there are many programs on the computer where students can get credit for classes. And sometimes students just need that one-on-one attention, and they're able to be successful. So we know the characteristics that he is, he's feeling, he's having problems with concentration, memory, and attention. And he's also, he's also very, I'd say, depressed. Depression is also an issue. Even though, again, I've warned you that we can't diagnose depression. What I say to parents is it appears the student has some very sad feelings. But I know just from being a counselor that he is grieving the loss of his abilities. So he has problems with his cognition, his thinking, memory, and reasoning. He may also have problems with communication, and he may have some anxiety, and we need to help him transition slowly. I would start by having a couple of friends come to the home and, have them encourage Jesse to return to school. And then I would say, well, let's, set up a time for him to go in and perhaps start classes 1 or 2 periods in the morning. And then we would go from there. And then we could gradually add more classes if we could. But I think the option of a half a day and a half a day in the Academic Support Center is a good plan. So what types of interventions might be addressed? I've talked about that. How can the school and Jesse's family assist him? I've talked about that. And what is your role as a teacher in planning and implementation of Jesse's educational program? Well, one thing that you could do is take a look at the work that needs to be done, and you could see how you could make that not so overwhelming. Many times I would have meetings with the teachers, and when the teachers would hear what everyone else was requiring, they'd then say, well, listen, you don't have to do this, this, and this. Out of a list of 10 things, maybe they'd cut it into 5 things. So that's one thing that you could do, is think about how you can give Jesse things to do and help him get through his program without overwhelming him. Now, the other thing I wanted to talk about with this final assignment is I wanted to, and during the seminar, I planned to discuss the case study of a student with ADHD. And with this final assignment, what I'd like you to do is break down your paper so that you address these areas. What are the psychological characteristics? You could have that as a subheading. What is the function of the behavior? What interventions would you use? What accommodations would you use? Because this student is named Fred and he has ADHD. The other sections would be classroom management techniques. You would have study skills, and then you would have physical changes that you could make at home to help this student. And then the last thing is you're going to look at the 504 sample form provided for Fred and describe your responsibilities as a teacher. So those are the things you're going to do for your final assignment. My suggestions would be to read the assignment guidelines, set up the paper so that you address each question, because if you don't do that, you will leave out something and lose points. Make subheadings so you don't leave out any information and you stay on topic, and check the scoring rubric.